medium ones are loxapine and also phenergan. Now, guys, I only really circled the most popular ones that we use. Honestly, you're going to really see a lot of haldol and a lot of phenergan, especially when people go code cray-cray and they're wild and crazy. And you usually have to pin them down and give them a shot of one of these in their butt. And I've done it in a lot of times. So you're going to see a lot of haldol and a lot of phenergan. Promethazine is what we give patients. Not only psychiatric patients, we also do promethazine before your patient goes into surgery. It's a sedative. It helps bring down and relax patients as well. So it's kind of a double use with your phenergan. Now, haldol is what they call moon juice. I got that term from the psychiatric ward when I was doing my rotations for the pediatrics, or less than 18-year-olds. They're like, don't freak out, man. They're going to hit you up with the moon juice. And I don't know if they called it moon juice because you inject it into the butt or the moon, or if it makes you feel like you're on the moon. I don't know. But anyways, you guys want to pause the tape right now, and you can write down these main drugs, the ones I circled, because those ones you will be tested on. Next is the patho. Patho is the main thing that we're doing here, is we are blocking the dopamine receptors, D2. Now, I don't know if you have to know D2, but that's the one. So dopamine, remember, you guys can pull out your card, your little dopamine card that I told you to make in the beginning of all the lectures. So if you didn't make this card, go back, watch the first video, and make that card, okay? Because this is probably not going to make sense at all. So let me move you in. Now, the big thing about dopamine is that it helps with muscle mobility, your motor function. So Parkinson's disease patients have a decrease in dopamine inside their neurons, okay, the little neurotransmitter. So they have pill rolling, shuffling gait. Now, we're not talking about Parkinson. We're just talking about dopamine. So what happens if we block too much dopamine? We're going to have a decrease in mobility, not being able to control our muscles. And that's when we get into really bad side effects called EPSE. I call it TAP because we can't control our muscles. And that will be a side thing we're going to go into. But dopamine is blocked. You also block acetylcholine, histamines, as well as your alpha-adrenergic. Now you guys are ripping out your hair and thinking, oh my gosh, I hate pharmacology. Well, it's okay, because I'm going to explain it and break it down for you guys. So, acetylcholine is blocked, so your patient's going to have anticholinergic effects. That's just fancy words for high and dry, increased heart rate, and very dry. So constipation, not a lot of saliva, dry eyeballs, and if you guys saw some of the other videos, you'll understand what the implications of anticholinergics, which we'll get into. You also have antihistamines, which can increase your blood pressure. And then alpha-adrenergic, which is anti-alpha-adrenergic, because your body is blocking these guys. So what happens when your body blocks an alpha-adrenergic? What does that even mean? That just means inside your blood vessels, you have those little alpha-adrenergic receptors on the lining of the blood vessel. So these little alpha-adrenergics help squeeze the blood vessels down and cause the vasoconstriction. Now, if we block these alpha-adrenergics, we are vasodilating, and vasodilation is going to bring decreased blood pressure. Also, orthostatic changes when your patient gets up in major side effects with your antipsychotic medication is a condition called EPS, extrapyramidal side effects. And these side effects are mainly because we have a decrease in dopamine, and we also have a decrease in acetylcholine, causing major anticholinergic effects, very, very dry effects. So, a lot of movement is going on, and a lot of uncontrollable muscle spasms. That's why I call it tap, because it's almost like tap dancing. Now that's what I call clubbing fingers, huh? So the first letter in TAP is your tardive dyskinesia. Now, technically, this is the most latest sign for your EPSE signs and symptoms. But tardive dyskinesia is pretty much uncontrollable movements of your tongue, your face muscles, almost like a Miley Cyrus. If you guys have seen that music video, Wrecking Ball, she's licking everything. I can't stop licking everything. So they were saying that a lot of people have made fun, said that tardive dyskinesia, she can't stop, licking things, and uncontrollable tongue, uncontrollable face movements. The biggest thing to realize, though, is that you have uncontrollable movements or motor movements because dopamine is being blocked. Dopamine is the major factor here. And if you guys still have your note card, you would have it and be able to pull it out and be like, oh yeah, dopamine is a motor function thing. You're going to see your patient have tongue, face, and neck spasms, as well as back spasms. Now, the biggest thing that we can do for your patient here is administer an anticholinergic, because we know that our antipsychotic medications, we are blocking acetylcholine, causing that anticholinergic effect. So, administer anticholinergics for your patient to get some moisture back in the body, to stop blocking and drying up things. Last one is pseudo-Parkinsonism. Now, pseudo-Parkinsonism is because we are blocking dopamine. It's the same thing as Parkinson's disease. Parkinson's disease, we have less dopamine in the body, actually in the brain and the synapses, as well as in the peripherals. So with Parkinson's, you have shuffling of a gait, you have tremors, you have pill rolling, and you have a shuffled gait that's like this. And that's because, remember, dopamine is that motor function. So if you guys remember TAP, T-A-A-P, it's just that tap dance because you have lost control of motor function, mainly because we are decreasing dopamine. Now, for your second generation, real quick, you have less incidences of dopamine blockages because you're mainly blocking serotonin with your second generation, for example, Geodon. Now you have less or fewer EPSE because you're blocking less dopamine. That is the main culprit there. And that's why I say, have your note card, because the note card will save your life, and you're going to be able to read with what am I saying? You're going to be able to bring it up and say, oh yeah, that's what dopamine does. That's why this patient gets side effects. That's why this makes sense. That's why that makes sense. Okay? So let's get back into the lecture here. The other side effects other than EPSE or ESPN or LMNOP or HIJK. Okay, so the other ones are sludge, and I kind of put it into an acronym called sludge. This was actually compliments of Katie, the psychiatric nurse over in Iowa, who helped me out with this. She uses a term called sludge, which means sedative, lethargy, urine retention, dry mouth, GI upset, and energy loss. So if you guys want to pause this and write those down as side effects, the main reason we're having all these side effects is because we are blocking certain neurotransmitters here, guys, and also certain mechanisms. So anticholinergics, we're having dry mouth, urine retention, GI upset because of the anticholinergics. We're doing sedatives because we are blocking dopamine, so we have lethargy and a lack of energy. So write these down, it's going to help you guys a lot. Now, one of the other major side effects that could occur is like a crisis mode is you have your neuroleptic malignant syndrome. This one also is a 911 emergency, a life-threatening emergency. Usually this happens in the first 2 weeks of your patient starting therapy on their antipsychotic medication. So what we're going to do is we're going to stop the medication immediately once we see signs and symptoms of increased fever, increased cardiac changes, and we're going to cool your patient down. That's actually one of the best things we can do for your patient. Now, this is because we're blocking a lot of dopamine and a lot of other neurotransmitters and receptors inside of the brain, where your thermoregulation is in the hypothalamus. So, a specific disorder called NMS, or neuroleptic malignant syndrome, can occur. The best thing we're going to do is just stop it and cool it down. Okay, so just know that this is a life-threatening condition. If you guys want to research it more, feel free to. I just wanted to let you know. So, other possible side effects other than the crazy 911 emergency is increased temperature, and we already know that, but this is an extra large problem, okay? So don't think that your patients are always going to have this. Increased temperature, muscle rigidity, increased heart rate, increased blood pressure, as well as altered level of consciousness. Now, the worst thing that could possibly happen is possible cerebrovascular accident. Fancy words for stroke. So what we're going to want to do is watch your patient's blood pressure, watch your patient's level of consciousness, see if anything is changing. We're going to look for right-sided weakness, muscle weakness. That's one of the best things that we can do for your patients. So we have a ton of side effects, and the major patient teaching is going to come off of our acronym SLUDGE. So we're going to make sure that when our patient becomes very dry, we're going to monitor their INOs because they're dry from the anticholinergic effect. We're going to take the medication with food because of the GI upset. We're going to tell our patient to stop smoking. This is actually something you should write down. Stop smoking because it shortens the half-life of the drug. Fancy words for the body gets rid of the drug faster. It doesn't stay inside the body. So usually they'll have to increase the doses. Now, some other things is that we should watch out for the labs, for the glucose labs, as well as your liver labs. That's your liver. Because almost all psychiatric medication is very harmful to the liver. Last thing is vital signs. Risk for hypertension, increased blood pressure, and increased heart rate. Now you're thinking, oh my gosh, Mike, I just wrote down what you said about anti-alpha adrenergics. You can have hypotension. You can have blood pressure changes, decreased blood pressure. Then you're saying increased blood pressure. Which one is it? Guys, we're talking about anticholinergic properties. When your patient becomes very dry, their heart rate goes up and their blood pressure goes up because we're activating the sympathetic nervous system. Now, we're blocking anti-alpha adrenergics as well as blocking acetylcholine anticholinergics. So we're pretty much have a teeter-totter effect. It could be one or the other. It's almost like saying, hey, we have ice and we have fire. Well, is it going to be hot or cold? I don't know. What's going to win at this point? So that's why we make sure we cover our bases here, because we're blocking a lot of things here. We're blocking your alpha adrenergics as well as your sympathetic nervous system, which is causing this dry effect. So high and dry. Now, if I totally confused you and you don't know what the heck I'm talking about, write this down and just go with anticholinergics. High blood pressure, high heart rate, and very dry. Okay, high and dry. Remember that. Hopefully you're sticking with me. Let's go on into our second generation medications here.